It is a major overhaul of the mental health system, and it comes through the efforts of dozens of Connecticut residents who provided months of input to Senator Chris Murphy. Now the changes included in that bipartisan bill are about to be signed by President Obama tomorrow. Chief Political Correspondent Mark Davis live in our Hartford newsroom tonight with all the details. Mark?
Hi, Darren. Good evening, everyone from the Hartford newsroom. You know, it is estimated that more than half of adults and children with mental health problems end up getting no treatment. This law is designed to address that. When Senator Chris Murphy returns to Washington tomorrow morning to witness President Obama signing the Mental Health Reform Act, he says it'll be the culmination of the most important thing he has done since he first went to Congress.
If your body is broken below the neck, you are more likely to get good care than if your body is broken above the neck.
49-year-old Kathy Flaherty knows firsthand. When she was in law school, she was diagnosed with anxiety and depression and has bipolar disorder.
Your doctor recommends something, and then somebody sitting at a desk at an insurance company denies it because they think it's not medically necessary.
And that's what happened to you?
And that, yeah, I think there are times where that happens. It's not only happened to me, it's happened to a lot of people I know.
Murphy notes that up until now, even if your statement of benefits says you have a mental health benefit in your policy, insurance companies require a lot of red tape that they don't when you are hospitalized for a broken leg or some other physical ailment.
It forces insurance companies to start paying for more mental health treatment. This bill now says that if you are denying treatments on the mental health side at a rate greater than on the physical health side, then you're in violation of federal law.
Kathy, who is now the executive director of the Connecticut Legal Rights Project, says the old way was penny wise and pound foolish because many people ended up in crisis.
When they don't give you coverage for low-cost interventions and you don't have access to the services and supports you need, you're a lot more likely to have to use the most expensive parts of the system when things don't go well.
And Murphy also says that under this new law, which again President Obama is going to sign tomorrow, there's going to be a single portal within the U.S. government where people can complain about denial of coverage. And after just 5 complaints, the federal government will take action. This is a huge bill. It also includes all kinds of cash for the various states, including Connecticut, for the opioid epidemic, and also for research on tick-borne diseases like Lyme disease. You can see the whole list and detail by coming to our website, WTNH.com, or on the News 8 app on your phone and clicking on the story. Live from the Hartford newsroom, Mark Davis, News 8.